I remember in the first episode, we talked about the systems of the body, and as I outlined them, you remember them very well: auditory, digestive, cardiovascular, all something like that. But as per today in the second episode, we're going to talk about a reproductive system majorly. In a reproductive system, this is a system which deals with reproduction. And in reproduction, we talk about multiplying, delivering or producing of other species that keep on inheriting our systems or our blood. What we talk about is birth, majorly in reproductive system. But one thing you should put into mind, in reproductive systems, we have organs, or we have parts in reproductive systems. And we have two reproductive systems. We have a male reproductive system and then a female reproductive system. Let's look at what we call the male reproductive system. In a male reproductive system, we have different parts in it, whereby we have the penis in it, we have the testosterone, we have the testosterone duct, and we have this prostate gland, and also we have these outer parts, which we say like the pubis and what, all those are in the reproductive system, and also the urethra, or whereby the sperms come out. And in that system, if you look majorly, we have problems associated with male reproductive systems. Which are the some problems we have them? We have the infertility problems in male. Yes, they are there. We have a low sperm production in this, whereby the testosterone can no longer produce the sperms. We have hormonal imbalances. Also in men, we have what we call the hormonal imbalances, whereby you might find that the hormones that are affecting the sperm reproductions are there. Problems of a man, whereby he cannot give a woman pregnant, cannot make a woman pregnant. It's also there what we call infertility. We have erectile dysfunction, whereby a man cannot erect. That's where the problems comes in, and a lot, as you know. But now with that, we are going to combine it with that. Now our topic is infertility. But let's go to a female reproductive system also a bit. And also in a female reproductive system, we have parts there. For a lady, it's a bit complicated because they have a part which is there, but it's not in to a male reproductive. What is the part? It's the uterus. And for the lady, she has ovaries. The two ovaries. A normal reproductive system might have two ovaries, and also those ovaries, they produce what we call ovums. And also with females, we have what we call the fallopian tube, or the reproductive duct, or the fallopian duct, which joins into the uterus. And now with that, with the uterus consists of three layers: the endometrium, myometrium, and endometrium, myometrium, and then there is that thick layers that is also outside of the uterus. And also on the uterus there we have what we call a cervix. A cervix also has three parts, and also we have what we call the vagina, and also the outer part, the pubis, and also, which you know, has also its own parts. The problems of the reproductive systems, we have the UTIs, or the diseases that affect the infection that affect the reproductive system of a woman. We have also what we call infertility. The infertility in a woman, whereby a woman cannot conceive after a regular or a continuous sex for a period of about 6 or 12 months. When he's having a regular or a constant sex, that is infertility. We have the ovulation problems, whereby we have what we call a polycystic syndromes, or a polycystic ovarian syndromes, whereby those production of ovum becomes abnormal, and at times they become stuck, or whereby the ovary also gets problems. We have ovary diseases, we have PIDs, which the blockages in the fallopian tube, all sort of. So the major problem that people look at in the reproductive systems or in the delivery system is infertility. And the same goes to male, whereby a man cannot make a woman pregnant or a woman cannot conceive. Those are the problems. So the topic is infertility, the major problem, infertility. These UTIs, fibroids, myomas, those problems, the cysts in the uterus, those things, we'll look at them with due time. But as for today, let's look at the infertility. As I've told you, infertility is when a woman cannot conceive after a regular sex, or is when a man cannot make a woman pregnant after regular sex. Now, what brings the problems of infertility? It's a lot. We have problems that comes in like diseases. Which diseases? We have cancer. If a woman's developed cancer, in most cases they end up failing to conceive. Those are diseases that affects the reproductive systems, the UTI what. And also we have another problems of a low sperm counts in male. If a man has a low sperm count, whereby the sperms are very low or they are weaker, he can fail to pregnant a woman. Now with ladies, majorly, if they have also hormonal imbalances, the luteinizing hormones, as we can see, the follicle stimulating hormones, when they are not balancing, a woman might fail to get pregnant. We have a blocked tubes, as I told you before. Those blocked tubes can come in if you have the consistent infections, the urinary, those who you can fail, and then in major cases also we call it the PID, the pelvic inflammatory diseases in the duct. As I told you, also the polycystic ovarian syndromes also can make a woman not get pregnant, and also consciousness of a person. Consciousness of a person can make a person not to get pregnant. Overuse of the family planning contraceptives. Those are like the family planning methods. For example, the injector plans, the pills. We have other methods that are hormonal, that affects the hormones, that can make you delay or can bring out infertility in ladies. So in most cases, if you're using them, we have to advise you, or you have to consult the doctors or the midwives at the maternity center to give you advice on them. So infertility is a lot. A poor ovulation system in ladies, because if we look at the ovulation system, a woman, if she's growing up, it is estimated that a woman in her lifetime, she has 2 million ovums or eggs that are produced. So with those 2 million, that means that in her lifetime, she can produce. Mostly, we have what we call the puberty system. In puberty systems, it starts within 10 to 15 years. That's when a woman, we expect her or a girl to see a menstruation cycle. The menstruation cycles also starts in between the puberty systems. When a woman sees her ovulation systems or the menstruation cycle, we say a woman is ready to get pregnant. And that takes a period until when she reaches her menopause. What do we mean by menopause? Menopause means a woman can no longer get her menstruation cycle. By this we mean a woman can no longer produce. But if a woman has all these things in places, the menstruation cycle, and also having constant or regular sex, and then she fails to conceive, or a man fails to pregnant a woman, is what we refer to infertility. So infertility is a problem in a reproductive system as considered with other systems. That's when you've considered you have all the organs of the reproductive systems in places that you as a lady, you have the ovary, you have the fallopian, you have the uterus, you have the cervix, you have the vagina, and you have the breasts in place. And you as a man, you have the testicles, and you have the penis, and you have those urethra and those things, and you ejaculate, you erect, everything when they are normal. Everything when it is normal and it is in place. The organs are there, they function normally, and also the lady, you have everything, and also you function normally, and also you go into your menstrual cycle in a normal systems. But if you fail to produce, that's what we refer to as infertility. So there we have to look for a way of to see how you can get pregnant, to see a way how you can deliver with that. So with the reproductive system also, we have what we call the maternal conditions into that. Getting pregnant, you are pregnant to go through that, and then delivery. Delivery pathways and what? And also we look into the pelvic parts, the types of pelvics. That one, if you are pregnant, the plantoid, the gynecological pelvic type, those things like the android pelvic type, those one we will look into them when also we are in the muscular, the skeletal system. But majorly here, the reproductive systems, I've explained to them, the parts as you read them, the ovaries, what and what, something. So what you should put into your mind, that for me to deliver or to see that I'm this, you should do the scan and then you confirm that you have the ovary. You should do the scan and confirm that you have the uterus. You should do the scan and confirm that you have the cervix. And you should do the scan to know that all the systems there, they are normal and they are put in their normal positions in the body, and they function. That also I go into the menstrual cycle. Same applies to the men, that I get my erectile ability, or it is normal. I have the testosterone, and I have the testosterone are not up, they are put down. But there is some the testosterone that are up that never came down. So with those also we do them. They have surgeries that they do, but you have to know that my testosterone are not swollen. They don't have any problem. I don't have any prostate problem. The urethral systems or the testosterone ducts, they are not blocked. I don't have any pain in my that. I don't have any abnormality. So that means that you will deliver and you have. So with reproductive system, I believe you've understood, and I believe you can answer questions with that. As I told you,